kind of a big passion of ours when we, look at maternal mortality in the state of Indiana. We're third to last in the nation for maternal mortality.
Now at 11, new figures from the CDC paint a grim picture for new mothers. The report says 4 in 5 pregnancy-related deaths are preventable. More than half of those deaths happen up to a year after the delivery, and the leading cause of death is mental health issues, including substance use disorders. WRTV's Lauren Casey gives us a closer look at how a new program at Franciscan Health can make an impact on maternal health.
Whew, it's been amazing.
A whirlwind experience for first-time mom Danielle Paymer.
Even though you're exhausted, the adrenaline that you have just to keep going is just unreal.
Little Esme came into the world with a full head of dark hair and on her own terms.
Towards the end, at 36 weeks, we found out she was breech.
Despite their best efforts to get that baby to flip, Danielle and her husband scheduled a C-section.
So at that point, I knew it was Esme's world. We're just living in it.
And the morning of her due date, little Esme kicked her mom into active labor. Danielle rushed to the hospital and prepped for surgery with Dr. Scott Bowers.
Well, we're making an incision that's about 6 inches long, horizontally in the lower abdomen to deliver a baby.
I am terrified. I've never had a surgery before. And the whole team, literally was just amazing.
Danielle took part in this new program at Franciscan. So it's called ERAC, or Enhanced Recovery After Cesarean. It all starts with this paper you get at your OB's office. It reminds you what to do before surgery and what to expect.
We used to make women fast for like 12 hours before they had, came in for their surgery.
Melanie Boozy is the clinical nursing manager for labor and delivery at Franciscan Health on Indy's South Side. She, along with Dr. Bowers, are on the team that helped bring this new ERAC program to Franciscan. The ERAC protocol includes steps for the expecting mom to take in surgery prep, non-narcotic medications before surgery, and methods for keeping the mother comfortable during surgery and postpartum. But the big change is managing pain without opioids if possible. And since the hospital implemented this program,
we have seen our pain scores go down with this program.
Less painkillers is leading to less pain. Without the narcotics, mothers are getting up and out of bed sooner after surgery, which is key.
It increases your motility, it kind of gets your everything going again.
It helps mother use less narcotics, but it also helps with baby's feeding.
It gives you the confidence to know that I can do this.
We're starting to recognize that there's a lot more to pain than just, ouch, it hurts.
Christine Hunkley is a clinical nursing specialist who brings clinical evidence to the bedside.
There's all kinds of things that cause pain and discomfort.
Narcotics are an option if needed, but they're finding many of these moms in the program don't request them.
So many people get addicted to the narcotics, not trying to be addicted, but started out with some type of a surgery.
We want to try to prevent that process from the very beginning if we can.
And for many new moms in the ERAC program like Danielle, avoiding the addictive opioids brings peace of mind.
I didn't want to take it and then not be alert if she needed me.
Now Danielle continues her postpartum recovery at home with baby Esme by her side.
I just want her to know that she's loved and that anything she wants in the world is achievable.
Working for you, Lauren Casey, WRTV.
And we broke down this ERAC protocol and the alternative methods to ease pain step by step in this story on our website at WRTV.com.